Does the evisceration, if you will, of former Speaker Nicholas Mattiello in this week's election represent to you a thorough repudiation by taxpayers of the decision not to bring together the state legislature and essentially do their jobs?
I don't think you can make that sweeping statement. I think for whatever reason, his constituents went another way. And you'd have to ask them.
Governor, on sports.
Governor, so I heard from one of the owners of an indoor facility that you shut down. She has a business that opened in June 1st, outdoor volleyball, all right? Played through the end of October, rented a facility indoors, 6 courts. She's doing all the COVID, appropriate stuff. She has high rent, overhead. All of a sudden, it gets closed down without any notice. So my question is, you said originally for a week. Can you clarify, are they back open or not?
They will be, yes. They will be able to be back open on Monday. And I'm going to let you say a few words, Janet. We are trying to get in touch with them to provide some remunerate grants, really, to help make up for the lost revenue that they've had this week. But that she's going to be allowed to be open on Monday.
Before Director Coy answers, so she sent me an email. She's got $11,000 a month rent. She's got utilities are $5,000 a month. Here's what she's doing: mask wearing, temperature taking, temperatures posted for every single player on Google Docs, verbal COVID questions, written COVID questions, equipment restrictions, forced hand sanitizers. She's doing it all right? And so why do you need to shut her down instead of going in and surgically, the easy thing is just to shut everybody down instead of saying, you know what, there are a couple bad apples out there, and I know there was a specific situation you were addressing, and this is not the only facility you've heard from. Why do you need to shut them down for a week instead of going in with all the contact tracing and everything that you do to say, we're going to shut this down and figure it out with Janet Coit over the course of a week instead of doing the exact opposite? And how is the state going to make them whole?
Yeah. So I'm just looking through. So it sounds like she is okay, so I don't know this person and I'm taking you for your word, but based upon everything that you said, she ought to be able to open up on Monday doing exactly what she's been doing, which is good news. Listen, you got to make policy for, broadly. Sounds like she's a perfect actor based upon everything you've said to me. Not everybody is. Not the majority are.
Just a few.
It's been all over the map.
Facilities that have said, we're doing the right thing, and we got penalized for it.
First of all, what people say and what they do every single day is different. You also hear from as many people who say, we're just not doing it. In other words, we're not going to do it. We're not going to follow the rules. Or they say yes, and then they don't do it, in fact. And when we show up and we look around, they're not doing it. So I stand by the decision to close for 1 week. We have worked to put in place good regulations. I know losing a week of revenue is tough. I don't know if we can make them whole, but we're going to send some checks out the door.
Governor, since you're allowing those...
Do you have anything to add? Because you've been talking to me.
Thanks, Jim. First, I want to say that sounds like that person is the gold standard, and we've talked to a lot of people who are doing a great job. We've done tons of outreach this week, and even folks who are doing a great job feel like standards have relaxed and that they need to kind of reboot. Many facility owners have said to us, we appreciate that you're strengthening the state standards because that gives us license to say, if you're not wearing a mask, if you're not going to give me a roster, you're not going to be able to reserve time here. The governor saw that sports cases, they increased 68% of the cases were in the month of October. So as we were moving people indoors for sports, the idea that we should take stock and put stricter requirements in place was intended to make sure that we could have a smooth season. But let me say on that too, that I am working with the Department of Administration to use the Federal CARES Act funding to provide reimbursement for losses sustained in this week due to the shutdown. So hopefully that will ameliorate some of what you've addressed.
Thank you.
Governor, so to understand correctly, spectators will be allowed 2 per athlete in those indoor facilities?
For kids sports, yeah.
For those indoor facilities. So does that apply to outdoor sports next week as well?
Yes, if they have a mask.
So that is a change.
Yes.
Initially, you had said that would
Yes.
be 2 weeks. Okay, so people who have complained that they won't be able to see the end of their high school season.
They can go to a player, 2 spectators per player, and you have to wear your mask.
Okay, and I know I hit on the school topic a lot. There are people who say, well, you maybe say there's not a lot of spread in schools, that it must be more than a coincidence that this rise has come after school started back up again. Has there been any thought or numbers that kind of back that up, that for some reason it's spreading more because of that?
It's an excellent question, and as you can imagine, we're trying to get our arms around it. A lot of things have changed, right? So it's not just school. Sports have come back online. We've seen big increases in social gatherings. We've seen, just anyway, there's not one isolated thing. What I can tell you is putting the kids in virtual school is not the panacea, because we're seeing just as much spread among the kids who are in virtual school. And as the days drag on with the kids being out of school, mental illness is up, children falling behind is up, kids not logging on is up, abuse and neglect is up. So, and we have 2 months of data now.
The numbers, this week for the numbers in school versus at home was almost 4 cases per 4 to 1. It was about 250 cases in school, about 70 virtual. I know more kids are in school twice as many, but the number in school is 4 times as many.
Yeah, thanks to a huge statewide data analytics team, we have been able to disaggregate our cases and really understand where the source of the increase is coming from. And we have seen consistently for weeks, there is community spread that has steadily increased, while K through 12, as well as other limited settings, particularly where there is structure, congregate settings, IHEs, where we've been able to control outbreaks on campuses for institutes of higher ed, have remained significantly lower in their cases, while the community spread not involving those scenarios have increased. Only now in this latter couple of weeks have we started to see a small increase in what you're referencing in both K through 12 and congregate settings. That really informs us it's more a reflection of the community spread occurring rather than being driven by congregate care or by the K through 12 setting. So it's basically our analysis of the data that shows the community spread as the primary driver, and then secondary increases can occur in those more structured settings, not the opposite.
Governor, you said your primary 7 restrictions are going to be in effect for the next 2 weeks, and then you went on to say that you may come back with more restrictions for Thanksgiving. Should we presume that this is going to continue on?
So, a couple things. Almost certainly we'll be back with regulations around Thanksgiving. I don't know what they're going to be, but it's weighing on us to try to figure out what that might be. Here's the reason I'm going for 2 weeks. We're going to look and see if this makes a difference. We're going to see, is mobility going to go down in the next 2 weeks? Are fewer people showing up to places of worship? Are fewer people having parties? Is there less crowding in some of the big box retailers? If there is, then I'm likely to extend it for another couple weeks. Massachusetts and Connecticut both did 30 days out of the chute. But if we're not seeing it being effective in terms of changing people's behavior, then I may have to change course.
Governor, you were saying that you saw on social media people planning parties, an apparent defiance, it seems, to what you're talking about. Are you monitoring social media to identify such cases, and are you calling these people, or what are you doing to actually prevent such parties?
If we are monitoring social media, and sometimes it's hard, right, to figure out all the details, but if and as appropriate, if we can be certain around who to call about what, we will certainly bring it to the attention of the school. And, the diocese, if it's a Catholic school. And yes, call them proactively and say, it's come to our attention that your kids are thinking of doing this. Don't do it.
Are you asking kids or parents to actually call you to let you know of situations?
Absolutely. Help us out. Let us know.
Governor, unless something changes, Joe Sacacci, it would seem, is about to be the next speaker. He was part of your 2010 campaign. For people learning about him for the first time, what can you tell the people of Rhode Island about Representative Joe Sacacci?
Hardworking, honest, smart, really collaborative, and just a very solid citizen.
Could you agree, though, it seems confusing. The General Assembly didn't meet because of COVID, but now the Democrats are going to meet, I believe, at the Crown Plaza tonight to caucus for him. It leaves a lot of people wondering.
I was not aware of that.
Okay.
All the rules that I'm saying here apply. Social gatherings can't be more than 10, there have to be social distancing, and they better all keep their masks on the whole time.
Governor.
But could I alert your administration? I want to be a whistleblower. They're meeting tonight at Crown Plaza.
Yes. By the way, model good behavior.
Governor, we're hearing already from people, you compare basketball, I don't know if you played basketball or not, you know you played rugby. Hey, you never know. Point guard, perhaps. But you compare basketball to wrestling, okay?
Yeah.
How do you determine the risk management there? What about eating at a restaurant at 8:15 versus 11:15 p.m.? You know, how did all of this come about? What's the science behind it?
Yeah.
Who's making these decisions?
So first on the restaurants and then on the sports. First I have to give a shout out to the Hospitality Association, who's been amazing partners. And they were the reason that I decided to do 10 and 10:30 instead of 9:30 like Massachusetts. We sat down with them. By the way, they're not happy about this, and I don't expect them to be, but they're telling us what's going on, and they're encouraging everybody in restaurants to follow the rules, which they have been doing, so I have to say thank you. Secondly, here's the thing about restaurants, about life. The longer we're together, you hang out at dinner for a half hour, it's pretty easy to follow the rules for a half hour. You hang out at dinner for 3 hours, you have a few drinks, you get tired, it gets late, you go back to somebody's house to finish the party. This is where we're getting into trouble. So I am not going to pretend that there's magic around 10:15, 10:30 versus any other time. But I do know we see problems when people hang around for too long and when they then, continue the party at home. And actually we have seen, to the extent we've seen trouble in restaurants, it's always later. It has always been, just the facts have been, clubs, bars, it happens after hours when people let their guard down. As to the sports, I can let the doctor answer the details. We're following, again, this is, wrestling. Wrestling is a high contact sport. There's no way to do that sport safely. There just isn't. Basketball is different. It's a little less contact. So we're following CDC guidelines and coordinating with our neighbors. My thing is I want as many people to play as many sports as possible, as safely as possible. But some of them, by their nature, like wrestling, is just tougher.
We saw the outbreaks, though, of the indoor soccer, frankly. In fact, outdoor soccer. Rhode Island Interscholastic League outdoor soccer. We had teams shut down for the season.
Really poor mask wearing.
So how, now after a week of these facilities being closed, what's changed going forward that it would make any sport safe? Wrestling's unsafe. Obviously golf and tennis are different, but for any sort of team contact sport of any level, are you saying that there's varying degrees of safe behaviors that can be applied here?
Yes, and also Janet wants to jump in, but also, this goes back to what we were talking about. We were starting to see in some of these indoor facilities bad trends. Yeah, maybe there were a few who were perfect actors and gold standards. But we were hearing from parents and players that they were feeling uncomfortable at a lot of these indoor places. People were starting to not follow the rules. We saw Massachusetts and New Hampshire ran into big trouble. So we just said, pause, get with the industry. It's not that the sport is any less safe. It's that we needed buy-in to the new rules. We tried to use the week to get buy-in to the new rules, or not even the new rules, but buy-in to the rules to make sure that they would be enforced.
I'd like to just add that the categories, high risk, moderate risk, low risk, they come from both the U.S. Olympic Committee and also the National State High School Association. So those are categories that many states are using. They base them on things like sustained contact versus intermittent, shared equipment, the size of the team. So they're pretty standard. We didn't make them up. But there's modifications and things that the Interscholastic League and other people are doing to try to further reduce risk in those categories. And then lastly, I do think people are resilient and they want to play sports. So when we've talked to the ice rink owners or the indoor sports facilities, they are working with us on these and on ways to make sure they're enforced because they don't want to close, they don't want teams to quarantine. So by and large, I think they're on board for the stricter standards for locker rooms, for mask wearing, for maintaining rosters. So I think we're in a better place now than we were a week ago.
Does not hosting out-of-state teams mean no college basketball or
No,
football?
The intercollegiate sports, they're following an NCAA protocol, which requires testing 3 times a week and a number of other measures. So they are, as with most states, they're exempt from this and they're following their own rules.
Just a quick.
So like,
If you would, Governor.
Yeah, I apologize. Everything we're saying here, NCAA sports follow NCAA rules, professional hockey and such follow those rules. This is for like adult amateur sports and, kids.
Just a quick follow-up. I asked you about testing last week, and there was a question about charge or not charge. You had said go to the portal. I heard from a gentleman, he said his wife works with somebody who tested positive, so clearly she wants to get a test. Went to the portal, but she's asymptomatic, and it kicked her out. Can't get a test, and then tried to go to the primary doctor. The doctor says you got to go to the portal. So, and it was specifically because of the asymptomatic. So do you have any magic to get her through the portal?
I shouldn't laugh because I feel for her, but I wish I had magic. That shouldn't have happened. I don't know what to tell you. I mean, thousands of people do it every day and they schedule. So get me your name and we'll help her out. But I can tell you it's functioning. People do it every day. We're testing lots of people a day. It's free. It should work. It doesn't mean it always does. It doesn't mean it's perfect. I mean, we've created all of this from whole cloth in the past few months, so there's going to be some glitches. We're trying every day to make it better, but let me know who she is and we'll make it happen.
Governor, if I could follow up on that, and the doctor may want to add on something on this as well. Asymptomatic cases, we still don't really have a good sense of their prevalence. There's various estimates. And the director of the CDC just recently said that states need to develop formal programs for surveillance testing to determine asymptomatic prevalence. And the doctor said earlier today that one of the problems with social gathering is that many people who attend those gatherings are asymptomatic and they can transmit the virus to others, and they don't know, and the people to whom they're transmitting the virus don't know, and as a result they're fooled into a sense of complacency because they're asymptomatic. So where does Rhode Island stand? And as I said, you may want to comment, the doctor may want to comment. Where does Rhode Island stand on developing a formal protocol and procedure for measuring asymptomatic prevalence in the community in a randomized, organized way, not even taking into account, the problems that Jim's reporting, which I've heard about too, with the portal kicking people out.
Which is frustrating to hear. technology is a challenge, and we'll have to do better. So two things, and then I'll let the doctor comment. Right now, our top priority with testing is even more symptomatic testing. Symptomatic, fast, symptoms, test, accurate, isolation, quarantine, contact tracing. At the same time, we are also, as I've said for a few weeks, ramping up asymptomatic testing. In some areas, we have a protocol which is well established that we're doing, and we're collecting the data. Nursing home employees, nursing home residents. In other areas, we need to do exactly what you said, which is refine the approach. You can't have mandatory asymptomatic testing, so we need to get as close to that as possible. And getting into, particularly like in places like Central Falls or high-density places, we have to be getting to the community and doing more asymptomatic testing, making it easier and quicker, and then identifying the positives. On college campuses, we do have a good program going. You know, we have been very clear with colleges around our expectations for weekly testing. We've given them guidelines, how often we want the whole campus tested regularly. So I'd say we are, I don't know, 3/4 of the way there to having a really buttoned up asymptomatic program. She says it was not wrong.
Governor Raimondo, throughout the year that this has been ongoing, we've all read anecdotal reports about businesses, particularly in the hospitality business, anecdotally, if you will, failing to comply and refusing to comply. A notorious case of a gymnasium in New Jersey. This past week, however, the tensions were ramped up a little bit nationally. Hundreds of businesses got together in Illinois under the advice of legal counsel, and despite the governor of Illinois' threats that, if you will, civil infractions, shutdowns, and even imprisonment, have decided to not comply with rules distinctly similar to what's happening in Rhode Island, citing effectively that they've been in compliance all along, that, as you pointed out, a significant part of the growth in the disease and reporting the disease has happened because of incidental interpersonal contact. How far are you willing to go in the state of Rhode Island, given this fomenting rebellion across the country against continued shutdowns? How far are you willing to take the authority of the state of Rhode Island in going after individual or collective groups of businesses?
So I think you can tell by my approach that I'm doing this reluctantly and in a measured way. The stay-at-home order is not an order, it's an advisory. The way we're going to enforce the restaurants is asking for last call at 10 and 10:30. To be brutally honest, like, if we get compliance with this, I won't do any more. So the answer to your question is we have to see if people comply. But the irony is the less people comply, the more we have to do. So it's just a balancing. It's just I don't think of it, to the answer to your question, I would like to not have to do anymore. And we'll see where we go.
Governor, back in June, you were at the Billy Taylor Playground and announced the state name change, and then question 1 did pass. What's your reaction to question 1 did pass on Tuesday?
I'm excited, I'm thrilled. I'm proud of Rhode Island. I think it's a strong statement. And, you know, obviously I was for it, and I encouraged people to vote for it, and I'm really pleased that it passed. It's a statement around the fact that Rhode Island is a place of tolerance and equity and inclusion. And I have heard from a lot of people since then, people of color, who feel good, who feel like, you know, they're proud to live in a state that did the right thing.
Last two, Anita O'Brien.
Governor, in regards to restaurants, just to clarify, other than the hours, is anything else changing as far as capacity goes, indoors and outdoors?
No, just the catered events. The catered events. Restaurants, it's just the time.
And in regards to the, the Commerce Association, Federal Hill, and the other restaurant groups, have you spoken with them? Because they're, crying foul here. They're saying that this could lead to layoffs and closures. So what did they say? Did you try to come up with a compromise, or were you sort of set in stone with your approach?
I'll answer, and then I'll let the Commerce Secretary answer. We did have a lot of dialogue, and we heard them. Again, it was because of them. Massachusetts and Connecticut, I believe, went with 9:30. I decided to go a bit later. And also, that's why immediately we're putting money out the door. Starting Monday, we're going to be getting checks. Within a month, every place is going to get a check of a minimum of $2,000 and up to $10,000, depending on how much business they estimate they're going to lose for the 2 weeks of the early closure. So I'm not going to pretend that they like it or even agreed with it, but I did my best to hear from them. And as I said, the Hospitality Association's been a really good partner through it all.
Governor.
Just to elaborate upon the governor's expression, the Hospitality Association has been remarkable. These are enormously tough times. Dale Venturini and the team at the Hospitality Association have been in constant dialogue with us, expressing which policies would be most detrimental, how certain mitigation would be helpful. The governor's decision is really directly attributed to that dialogue, which is to say we're open for longer than our neighboring states, and the last call approach is more flexible. I also do want to give credit to the Federal Hill Association and to affiliated restaurants that have organized. Their dialogue has been enormously helpful and constructive too. We know this is very, very hard. I want to remind restaurants that we've seen a great number of restaurants apply for the Restore Rhode Island Small Business Grant Program. There's no employee cap. Any restaurant or caterer is eligible for that program up to $30,000. If you haven't yet applied, you're eligible for that. And you're eligible for the governor's new check in the mail program, which more details will follow on. So we encourage restaurants to do both.
Any individual actually been fined yet for hosting a gathering that goes over the limit?
I don't think so. Correct, Josh? I think not.
I know people hear you get up here, you talk tough, knock it off with the parties. Why not do that? Again, kind of as the question about certain facilities, why not target certain people and send that message?
Yeah. Sorry to interrupt. 2 reasons. One, we've intentionally tried not to until now, and it's only been in the last week or two that I've said we're going to really crank up enforcement, and we are trying to do that. To the question Pat always says, there's a certain amount of due process. So we're not going to levy a fine unless we can be sure that people violated the rules. But we're going to start to do that. I've been talking. We're changing the way we do business. The colonel has his team on it. We're talking to local police. I wanted to avoid it, but we're going to have to start doing it.
Governor, last question, follow-up. When do you expect, if Representative Shikarji prevails, particularly since you have a good working relationship with him, when do you expect to sit down with him to reinstitute, to work to reinstituting our legislature, particularly House oversight?
So first, the business of the legislature, they need to get together and pick their leader. And if it is Rep. Shikarji, then of course I will sit down and work with him. The first order of business needs to be to pass a budget. So what we have said and what the Speaker, Mattiello, and Senate President have said is they're going to come back in November to do that, and I'm going to hold them to that. So that's the first thing we have to get to work on, and whether it's Shikarji or anyone else, we'll be getting together with them right away to say, okay, guys, let's pass a budget.
Candidates, or if you will, candidates Lanning and Mazars told me this morning that if she were elected Speaker somehow, that she would want to reconvene the General Assembly immediately. Do you find that would that be appropriate in your mind, that they would reconvene virtually or in person right away?
Virtually, again, the legislature, I have never and will not start now to tell them how to operate their process. If they decide they want to do that, I would encourage virtual or some other, that it's a hard body to get together in a way that would be safe as it relates to COVID. I mean, you know yourself, it's hundreds of people by nature getting close together. So look, I support that they haven't. I support that they've tried to follow the rules and lead by example. We do have to do a budget. We are going to have to figure out a way to reconvene. Virtual is better. And, you know, we'll just see where it goes.
How can anybody consider a budget when things are so much in doubt at the federal level?
Yeah, you know. That's why I've waited this long, but now we're getting to be halfway through the fiscal year, and I think we have to do our best. It will be imperfect. It could very likely change if, hopefully, knock on plastic, we get a stimulus, but we have to try now. Thanks.